All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So this is our chit chat, the fun time. So let's see what's going on. So Drbeen, hello, Sher, hello, Christy, Doug, Dr. Z, Kelly, S. Sun, Drbeen, Rima, James Crooks, Shri, Arun, Susan, Doug, Gold Country, Carlos, Yvonne, and a lot of folks. Jim. All right. So, how is everyone? So, hello to everyone. How is everything? Who would get us started with a question? What did you think about the discussion that we just have? I saw a few questions. One of the question was Dr. Samina Chaudhary said, I'm above 60 and no side effects, and that is possible. Immune system sometimes does not react. However, this is actually a good question that Doug had asked. What is the age range? That would tell us what was the range of people who were covered in it. Let me see. I should have seen that before. I don't see the age range, but that is a good question to understand how far did they go. They did say greater than 60 years of age. So again, antibodies were produced in everyone. Sorry, I was trying to see the age. All right, so that is one. Alex says, is it then safe to say that second shot of a COVID mRNA vaccine, let's say Pfizer, will potentially provoke stronger side effects than the first one? At least in their study, the first shot had significant side effects, or clinically significant, meaning something that people would say, hey, I'm bothered. 5%. Second had 43%. So according to this study, yes, for the second. 61 is greater than 60. Yeah, that's correct, Doug. Very good job. Steve says, I've seen some docs predict Delta wave will crash in US in 4 to 6 weeks, while others think it will only get worse and worse. Where do you fall on this one? So I think that we should be getting out of this. No, I don't believe in getting worse and worse. Getting worse is not the variant only. It is people's behavior as well. It is masking, not masking, distancing, not distancing, caring, not caring, and so on. So it's not the cohort, the type of people exposed to it, their age, their comorbidities. There's a lot more than just the variant. Paulette says, how is my friend Luffy? So let me show you Luffy. Luffy is actually doing better because nowadays my wife gives him the pill earlier in the day. So he sleeps during this and he would actually become awake in a few minutes and then he will start doing what he does. So let's see. There. He's sleeping there. I don't want to wake him up, but hey, Luffy. What you doing? So he's sleeping. He will wake up in a few minutes and I think he'll wake up while we are having our discussion and go on to his riot. Matika says, new to the site. Hello, you all. Hello back. Which vax did I get? I got Moderna. Jocelyn, welcome. Okay, so that was Luffy. So Eric says, any comments of people still getting headaches and brain fog 10 weeks post-vaccination? Any resources to read? For the management approach, look at the I Recover protocol on flccc.net. There are so many varying pathologies Dr. Bruce Patterson and his papers are interesting to see what could be one of the pathologies, and that is monocytes carrying S1 protein species in it. Then Dr. Afrin's discussion about a possible hypothesis of mast cell activation syndrome or unmasking of that syndrome. Then, and there is another study that shows that blood cells can become damaged and for the life. So blood cells do not live on forever. They have a life, all of them. Some days, some have a life of weeks, some have months. And so when they recycle, the newer cells are corrected in shape. But as long as the deformed cells are present, they can cause an issue as well. That is another theory or observation. Actually, it's a study, and I have discussed it. Then there is a possibility that mast cells are reactive and they do not calm down because T regulatory cells are not able to calm them down. So that is another study, and we have talked about mast cell activation syndrome as well. And there may be more. So this is what we know so far. There may be more. However, what I'm seeing is that I recover protocol is it covers majority of these issues. So regardless of the underlying pathology, one of the steps in the I recover protocol will work. SNC Nutrition says if you had COVID last March, really bad, and recovered, and you still have the antibodies today and had the number of antibodies checked at 15,000, would you recommend a vaccine still? I will not take a vaccine if my body can react and is able to react. So for me, that is the answer. Again, everyone has to make their own decision. But if that is the case with me, that I was exposed, recovered correctly without any cytokine storms or ending up in a hospital or near death, then I would not take the vaccine. Gazar says, will vaccines be required for the long term, perhaps forever? From the other SARS-CoVs that we have seen, SARS-CoV-1 or MERS-CoV, it is seen that the immunity continues for 2 to 3 years, and then a T cell immunity continues for 10 years. Then I discussed a study few weeks ago. I believe the title of the video was long-term protection with the vaccine, with the natural infection. The study was that people who have infection, and I would extrapolate that to vaccine, the memory B cells go and live in the bone marrow. Most of the time, when memory B cells live in the bone marrows, they live there for the life of the person. That means ideally, it is possible that protection would go on for years and years. If that is the case, we will not need to have the continued vaccines. But we'll see. I think we will not need to, but time will tell. Future is not very clear. Steve says, by the way, I got a third shot yesterday, almost 5 months after first pair. Now, after 5 months, now new one was Moderna, first pair was Pfizer. No side effects to any of these. Had antibodies checked in May and they were there. Very interesting. So, Steve, was this a decision just you wanted to have the booster, or again, if you like to share? Barbara says, we hope he does wake up and feel better. Yes. So he actually, while we were talking, he got up, changed his position, and lied down again. Hey, Luffy, what you doing? He is not in a mood to talk yet. Coco Bean says, love your lectures. Thank you very much. JLB says, question, so someone vaccinated with IgG will not spread virus as a cured COVID patient. Spreading virus is a different situation. So let me explain it. I have done this discussion before. The short answer is they may spread virus for a few days. So if I start a Save this one. So I'm gonna, so let's say somebody had the infection and they have recovered, but they have memory cells now. So these are memory cells. They get reinfected here or exposed again. So now the virus that has ended up in the nose or eyes or mouth, um, that virus, let's say it is Delta. Delta does rapid destruction. So it is possible that for a couple of days, Delta is growing fast, increasing in count faster, and even cause some symptoms. And during this time, it will be shedding as well. If the viral load is sufficient, would it shed in everyone? It depends upon the person's NK cells, immunity, active immunity at that time or not, etc. But it is possible to shed during this time. After that, immune system cells will wake up, they will proliferate, they would increase in number, they'll make antibodies, they'll make more cytotoxic cells, they would take over possibly the virus and bring it down. And because of that, the shedding would stop. So, can shedding occur? Yes. Will it happen in everyone? That is not predictable because it depends upon the state of the person and their IgA and their IgG and so on. But shedding can occur. Rima says, why are so many vaccinated getting so sick and hospitalized? Makes no sense if we are vaccinated and 99% of people get antibodies. So, Rima, I actually have to look at the data to see that those who are becoming hospitalized, what is their comorbidity and what is their age range and when did they get the vaccine? Is it the possibility that, let's say, I have comorbidities, let's say two comorbidities, cardiovascular system and diabetes. Both are dangerous. I got vaccinated somewhere over here. I have memory cells. I got re exposed over here. My memory cells will become differentiated and proliferated and differentiated in 2 or 3 days. During that time, I am at risk, severe risk, based on my body state. And so here, if the delta has ended up destroying a bunch of tissue before my immune system wakes up, then my immune system may have already lost if the damage is too much. So that is what is the important thing to keep in mind. Good question. I'm going to look at some studies as well. David had shared some studies from or links from Israel too, and I did not get a chance to look into them because I wanted to discuss the topic that I did today. So Elaine says, 32-year-old, healthy, thinking of getting my first shot soon. Pfizer or Moderna for a lesser chance of side effects, of course. So the way to think about this, and this is not an advice for you, but generally, uh, the map looks like the following: youngsters lesser than 30, boys. For me, they're boys because they're youngsters and I am 50. So men, boys, the lesser than 30, they have a possibility of cardiac inflammation with the mRNA vaccines. Women, on the other hand, lesser than 50, women or girls, again, girls, whatever age, girls, women lesser than 50, they will have, again, this is rare, but from a symptom set, they can then decide which one they want to have. The adenovirus based vaccines can cause clotting. So these are the two main groups of issues that may be possible. Other than this, the side effect, simply fever, chills, fatigue, that is going to happen. And that should not scare you. That's going to happen for a few days and go away. Another side effect that, again, is not measurable that who will it happen to is the long haul. Do you want to see something? I think you would like this. If I go to this camera, stop sharing, check this out. Oh, that was Kyrie. She went away. Kyrie was just she was trying to wake up Luffy. There she is. Sorry. So sorry, there is a side show that is going on when I'm talking. So, Elaine, I hope that answers that question. Depends upon the age. Of course, you said the age, gender, and comorbidities, and then based on that, you can decide adenovirus based or messenger RNA based. Uh, I don't have much data for the inactivated virus. That is just because we don't have it here in the US. Um, Neither the nasal sprays. So this is the data. Long haul, no idea. So this, I hope that is the answer. All right. Carol Ann, Raj's mom, says, do you see any reports of issues with vaccines or infection bringing on seizures in people with a seizure disorder that is well controlled with Lamectal or other seizure meds? I have not heard of that. I have heard of the allergic reactions, but not seizures. Barbara says we love the sideshow. Kyrie and Luffy, yeah. So Luffy came in. She tried to wake him up, but sorry, Kyrie came in, and now by the time I tried to bring the um, camera to her, she left. Let's see. Next question. MSNBC says thoughts. Ivermectin or monoclonal antibodies for. We had the same question yesterday as well, MSNBC. I don't think that I will ever respond by saying one of them. If they are available, they both should be taken. So, and I think it can be done that they both are taken. And I would also not say just ivermectin because monoclonal, if available, they are great. Actually, polyclonal should be available as well. News says pregnancy is improving my long hauler symptoms. Is that something to do with the T cells behavior? Is fascinating, worrying, and worth to investigate. So many times in pregnancy, immune system gives a break because break meaning break to the person. The reason is that immune system does not inadvertently attack the developing baby. Because of that, immune system usually stays in a lower drive during the pregnancy, and that helps baby to develop, which is actually a foreign antigen. Our whole body is a foreign antigen to our immune system, and it has learned to tolerate us. A developing baby is not learnt by our bodies or women's body, so they actually have their immune system toned down. So many times these outcomes are because immune system is toned down. Usually, unfortunately, it can bounce back after the delivery. It actually stays toned down for some more weeks and months, and then it starts ramping back up. So M says, is it safe to have a vaccine if you have autoimmune disease? So the only guidance so far is to not take or be careful if somebody have had allergic reactions. They have not given any guidance on autoimmune diseases. Jocelyn says, still waiting for Novavax. Do you think it will be approved? Will big companies prevent it? And any more news on what is delay? So, to me, it seems like Novavax is not able to pull together what is necessary to get approval. Maybe the paperwork, the data processing. I hope it will be approved. My feeling is it will not be, because by the time they're going to come to the door and say we are ready, at that time US is probably going to say we are not in a need. That's what my uh, fear is. Maybe I hope they get approved. So, Camera Tigger says, Dr. Bean Michael Yadon stated that inactivated vaccines are better than messenger RNA vaccine and mRNA are experimental. Would you say that Sinopharm is safer than mRNA or DNA vaccines? So, from a theoretical point of view, and let me share my screen as well just to kind of respond to this with some mechanism as well. So experimental is just a extra layer of adding confusion. I'm not going to look at the experimental because this is now given to billions of people, and this is what it is. So if we are going to compare messenger RNA to other, we should already know that these are in the experimental stage. And if that is something that is going to sway us, then the rest of the comparisons are of no use. Then you should simply say, this is experimental, I don't want it. And then that is your decision. For me, I was actually very much excited and I hoped that I got Novavax. And then if I didn't get that, then I would get Moderna. And I got Moderna. So I am actually excited for the technology. And one of the reasons that it is, um, I'm excited because I understand the mechanism. There are so many folks who have created so much noise and confusion that the actual pristine, clear mechanism has become all muddied up. And so there is lots of just weird information, misinformation, misguiding of the people. And so it's muddy. So I'm not going to look at this one, because if this is something that is going to sway you, then sure, there is no need for this vaccine then, because it is experimental. Then you go the other way. Now, then the second part, that is it better or worse than inactivated virus? Two ways to answer this. First is simply from a data point of view. What we are already seeing, and I do not have that data, I have articles for inactivated virus vaccines versus messenger RNA vaccine data. So, articles or news, the news here are showing that the inactivated virus vaccines are less effective compared to messenger RNA. But now let's balance it out. This article saying less effective may be because of a bias against these vaccines. So one of them is from China, for example, the other one is from India. So there may be a bias to say they're not working. There may be some truth in there. I don't have that data to actually see their efficacy. So that is one. Second, look at the mechanisms. From a mechanism point of view, inactivated virus, so let's say this is the inactivated virus. Inactivated virus is actually a better vaccine compared to just the spike protein based vaccine like messenger RNA or Novavax or others, which are just going to wait on the spike, bank on the spike protein. Why is the inactivated better? Because it shows to our immune system almost everything of the virus except the RNA pieces, which are inactivated. Because of that, our immune system get to know the virus or get to respond to virus for multiple epitopes compared to a fewer epitope types present in the spike protein. Having said that, will they both work correctly? For example, the efficacy of the vaccines with the spike protein, is that as good as efficacy here? Yes. there are news that this is less efficacious, the inactivated virus vaccine. So from a functional point of view, messenger RNA vaccines are doing fine. So to say that we should only work with the inactivated virus vaccine, I am actually more hesitant for the inactivated virus vaccine. My reason for hesitancy is the what if it is not inactivated correctly? Then what happens? That is usually the issue with the inactivation or weakening, that if it is not done correctly, the virus could become reactivated. So that may be just an less significant concern, but it still is my concern. So if somebody put inactivated virus in front of me and messenger RNA, I would go for messenger RNA. I saw one was super chat, but it went. Why was a conventional vaccine not used instead of an experimental mRNA vaccine, which is risky? I think it is very simple. Whichever vaccine could be built fast enough, that was done. I don't think there is a conspiracy. And so if somebody believes in a conspiracy, then that question is not fair to me, because I cannot think in those conspiracy terms and then respond. So for me, it is very simple. They were in a scramble to say we need to have a vaccine. Messenger RNA companies could produce a vaccine very fast, and they made it. Good for them. They made it. The adenovirus based vaccine, they were able to make that. Oxford was able to make that rapidly as well, because they were making a vaccine for SARS-CoV-1, and they said we started working on it, then SARS-CoV-1 disappeared and we stopped. So all of their documentation, all of their design, all of their projects were already there, so they just reactivated them, and that is how they could come up with Oxford, which is adenovirus based vaccine, quickly. You could say that adenovirus based vaccine, that came in first and got approval first. That is sort of a traditional vaccine. So then you go to the inactivated virus vaccine, or weakened. Weakened should never be done for SARS-CoV-2. Then we are left with inactivated as traditional. And inactivated are there. One can say that, hey, I just want to have an inactivated virus vaccine. That is their decision. But I don't see any conspiracy in this one. Good question, though. I actually think medicine is such decently advanced. Here, I think this was the other question. Coyote old man, I'm 64, had massive stroke in 2019, have high blood pressure on meds, have stroke, fatigue, also diabetic, 10 years now, meds taken as needed, messenger RNA or Nova. So we have no idea when Novavax is going to come in. So if I am in this situation, I will take whatever vaccine I have available and protect myself. Nova vaccine would have been great, but it's just not there. Elizabeth says the FDA has a deal with Moderna and are profiting off of the Moderna vaccine. I would say it once again. The companies that are making vaccines in the US, have you heard of a company that said we have made inactivated virus vaccine and let's use that? Moderna lucked out. Pfizer was great. J&J in different technology. Oxford different technology. So once again, FDA is profiting, is doing their commercial things, their influence thing. That is all, I think, in front of all of us. Still, what is available to us, I don't think that itself is a conspiracy. Jack says, how does systemic antibodies help a lung infection? Jax, I need a little more clarification. Systemic antibodies means what? All antibodies become systemic. For example, let's say I get SARS-CoV-2. It would arrive in my nose, throat, eyes, and the antibodies will start with the local reaction, but then they will become systemic. They will circulate in the body. They'll go in as many tissues as possible. B cells will circulate in the body, in the blood. They'll go to various lymph nodes. They'll go and sit in the bone marrow as well. So please clarify, what do you mean by systemic antibodies? Do you mean IVIG like things? So Joel says, comment on EU EMA kidney injury after messenger RNA. Rare. I have to see that. So I heard that. I did not look into it. In my head, I remember when I looked at this headline somewhere or tweet. The thing that came to my mind was antibody complexes. There are a couple of ways that renal damage can occur in a disease. And take a vaccine. So I don't think so. Let me explain possible ways, and I have to look at the study to see what is the mechanism there. One possible mechanism, again, I don't think this happened, but one possible mechanism is that you make the person, whoever, they make antibody against some part of the virus or the vaccine. And then that antibody cross reacts with the kidney's tissue and then goes and attacks there. So cross reaction or mimicry. Mimicry. Now, mimicry had not been observed other than mimicry for platelet factor 4 or mimicry for cardiac tissue causing clotting or cardiac inflammation. Renal tissue mimicry was not observed. So, is this really possible? I think it will not be, but that is one mechanism. Another mechanism that can cause damage is, let's say, the antibody and antigen complexes, and those antigen coming from SARS-CoV-2 or from the vaccine, whatever that is, those complexes are tumbling around in the circulation, and they usually can get stuck at the glomeruli because glomeruli are the filtration system, and there many antibody complexes can actually get stuck there and they can cause kidney damage. So let's say these as the filtration is occurring and there are narrow pathways and the narrow filtration membranes, over there these antibody complexes get stuck there on the kidney. If they do get stuck on the kidney, then wherever the antibody gets settled, if it is bound to an antigen, that means it is sort of an active form, then it activates the complement system. When the complement system activates, whatever surface antibody is sitting on, that is like marking. So if an antibody marks me, the complement and the macrophages would come and try to kill me. So wherever the antibody sits, that cell, pathogen, that tissue is in trouble. So if the antibody sits here and the complement gets activated, then the innate arm macrophages get activated, then that can cause kidney damage as well. A third possibility is that, let's say, because of the vaccine or the infection, the person's cardiovascular system doesn't function correctly and gets depressed. So if the CVS becomes depressed, the kidney are the most sensitive for the blood supply. They need liters and liters of blood to pass through them every minute, every hour, every day. So if they don't get good circulation, they start getting damaged very fast. Acute tubular injury can occur, acute ischemia can occur, the kidney can actually start dying immediately. So if in somebody the cardiovascular system got affected, which is possible, let's say cardiac inflammation or let's say endothelial damage, something like that happened, and the cardiovascular system went down, that can put renal system at risk as well. So low blood pressure and low blood volume or low circulation can cause that. That could be blood vessel dilatation, that could be low force of contraction in the heart. Other inflammatory conditions of the system could indirectly damage the kidney. So these are possible mechanisms which would cause the kidney to be damaged. I'm just thinking that can there be something else? So direct attack, antibody aggregating, cardiovascular system going down. There could be one more, and that I think in the case of vaccine is going to be difficult. In the case of infection, that may be possible, and that is that kidney is very rich in ACE2 as well. There is lots of ACE2 on the kidney as well. Actually, one of the most abundant tissue is kidney with the ACE2s, then GIT and the cardiac tissue, and then lungs and the brain and so on. So if there was the virus itself that could come in, replicate, increase in numbers, then come into the kidney and cause damage, that may be possible. But that would need lots of ACE2 based damage. Truth Seeker says, hello, Dr. Bean. Fifth day with symptoms, PCR test positive, fully vaccinated 2 months ago, taking ivermectin 0.4 milligram per kilogram, mild temperature 37, lost smell and taste. Should I take antibiotics as well? Antibiotics are good to take. Um, Ivermectin is important in a higher dose, and then vitamin D and other things. Are you talking with your doctor as well? How are they managing? How is your oxygen level? Can you connect with me maybe on Twitter or on Discord, or send a note to support at drbeen.com, and tell them maybe we can discuss your situation separately. Inner G84 says ivermectin versus Delta variant. So there is nothing so far. Let me just use this drawing pad that I already have. So one of the possible function of the ivermectin is to bind between the virus and the ACE2 here. So let's say the delta has gotten enough mutation on the spike that this function of ivermectin is reduced, ivermectin efficacy is reduced, then it is possible that the virus can still continue to get into the cell and cause damage. However, when the ivermectin is inside the cell, we know that there is RDRP disruption, we know that 3-chymotrypsin like protein protease disruption, we know alpha and beta important disruption, nuclear factor kappa B. The virus cannot block these. So ivermectin would continue to be uh, valuable against Delta as well. I saw this random. So random says, what is the IgG measured? I got a positive diagnostic with RI43. Not sure how much it is enough to be sure I can skip the vaccine. Uh, on the test, there will be a threshold given. They would have said somewhere on the test to say, your result, let's say 43, and positive or reactive greater than 6, and baseline 6, and non-reactive lesser than 6, something like this. So based on this, if you have more than this, then you have an active immune system. So Bell's palsy, we discussed that once before as well, that Bell's palsy could occur just because of inflammation or reactivation of the viruses, or direct nerve damage as well. So I'll look into if there is more clarity in the mechanism. Ahmed Kutubali says, First concern, are you using iPad or trackpad from laptop? Neither. Second concern, I took my first dose was Pfizer, and second I took Moderna. Is it okay that these were who was feeling 2 days insert body temperature? So generally, in UK studies where they mixed and matched, they actually found that mixing and matching created more intense reaction to the second one. That means more immune response. So ideally, from UK studies point of view, mixing and matching is fine. D. Miller says, I work in high risk environment, caught COVID in April this year, then again in July. Wow. Fared away way better the second time using ivermectin, but worried about variants now. Should I get vaccine? So I would never stop you from vaccine. I always say, and I would repeat that, but again, it's not a personal advice. I think that somebody who have had the COVID and became okay without any issues, they actually don't need a vaccine. However, if your environment is high risk, if you want to keep your sorry, Luffy just woke up. If you want to keep your system active, then vaccine can be a good option as well. Let me show you Luffy. He just decided to wake up, so let me show you Luffy. Hey, Luffy. Luffy, what you doing? So Luffy's up, and wait for him for a few more minutes to start placing his orders. Okay. Alex is saying, is Luffy male or female? So Luffy is a male, Kyrie is female. CJ, if J&J, you have said, of J&J, you have said adenovirus can persist up to a year, can produce antibodies for 8 months, may bind to our DNA and continue spike production. Are there studies we can look at? So the news from J&J is that they feel that this can continue to produce antibodies for a year. When they had this news, or they said this was seen mostly by my wife because she got J&J and she wanted to understand how long would this happen. This they declared that news when their own vaccine had not gone through 1 years of the completion. So that is that part. Now the part where the vaccine, adenovirus based vaccine, go into the nucleus, that you can simply Google and see it. And if you didn't find it, tell me and we'll Google together. So Rima says, how widely available is Delta variant testing? Do all hospital test the variant? When they report these numbers, are they actually confirming it's Delta or just assuming? They do spot tests. So they would take, let's say there are 1,000 patients, they might take 100 patients and use them to test. And then based on that, they would extrapolate. They don't sequence everybody's DNA, or meaning virus. Lynn says Luffy is stunning. Yes. Now he has started grooming. He's totally awake now. Roller girl, thank you very much. What are you talking about? Matt Jack says, you own this lie, period. What lie? Who are you talking with, Matt? What? You are selling a lie. Please don't act like you didn't know it in 2 weeks. Know what in 2 weeks? Are you addressing me? So Augie says got swollen lymph nodes after lufumectin. If that is what happened, please reduce the dose or stop it and then let it go back to normal. And you could start. with a smaller dose, you can talk with your doctor and just make sure that it is not some reactions. Luffy is in a very energetic way grooming himself. Thank you very much. Okay. CJ says, thank you, Dr. Bean. You're very welcome. CJ, we can look into this together. If you're on Discord, just message me. Yes, so MSNBC, I think that that is what they're going to do. They are going to create vaccines with the Delta variant. I hope that when they create the messenger RNAs for Delta, they probably would keep the previous one in there as well to create a greater um, coverage. Luffy is still at his grooming cycle. Matt Jack says the lie is the vaccine will help, not hurt. You are pushing unknown danger on the young. And how do you know that this is unknown danger? You're calling it unknown and danger. How do you know that? So I think, Matt Jack, this is not a place for you. Um, you got to go to those folks who feel it that way. We don't feel that over here. Random, is the pandemic going to end this year? Random, I had thought that pandemic will be over by June, July. So of course I am wrong. This is August now. And I'm hoping that it is going to be over in this year. So Gerardo says, my red blood cells, hemoglobin, and hematocrits are going up since I had COVID. Why could this be happening? Perfect lungs and CT scan, saturation 94, 99. So the how long has it been? I did discuss a study where we saw that red blood cells and their shape can change, but the newer ones that are built, their shapes are okay. So that means those red blood cells whose shape is changed in normal healthy people, these red blood cells can continue to live for about 90 days. So it is possible that for 2 to 3 months, the blood uh, labs may not be correct, and then they would start becoming correct. So I think it depends upon how long back. Shireen Davudi says, hi, Dr. Bean. After vaccination, is there a way to find out? Okay, so 1 second. I want to show. So this is moment by moment news of Luffy. Check him out. Luffy, what you doing? Are you all alert now? What? Luffy, what's going on? You still sleepy? So I like him. Okay, so back to the question. Shireen Davudi says, hi, Dr. Bean. After vaccination, is there a way to find out if one ever had COVID prior to vaccination? Are there antibodies created from vaccines and from COVID virus the same or different? So, after the vaccination, it is an interesting question. If somebody had actual infection, then it is, I mean, this is a research level thing to do. And that is that if it must be known, then one can take the blood samples, antibodies, or memory cells from there and react them to non spike proteins of the SARS-CoV-2. And if there is some reaction, that means there was infection with the virus, but spike protein based reaction will not rule out the infection or rule in the infection, because spike protein does the same from vaccine as well. It's a good question. A researcher can cross react them. Well, of course, it is difficult to cross react them because these inactivated virus proteins need BSL 3, 4 level. And so these are difficult tests to do unless there are decoy viruses or empty virus shells available, but it's a difficult test to do. Irene says, "It's so sweet how much you love your cat, Dr. Moon. There's no doubt you're a very good man. Thank you very much." It's actually, he just sat down. He's actually so cute. And Luffy actually expresses his love in a very interesting way. Remember that when I went out to my colleague who needed help and I stayed with her for a few days, when I came back, Luffy will not get up from here for next 7-10 days. So he has found his place. He has created his place. Let's see. Baljit Singh says, "Are CD8, CD4 tests commercially available in the US instead of testing antibody titers? Can I get T and B cell responses tests in commercial labs?" So there is a test called T Detect. It is approved by FDA and it looks at the memory T cell in blood. So that is available. And that proves if you had infection or if you had vaccine. So Jack says, during the pandemic, billionaires. So there was a study done where they took rich folks and they put them in another environment without any money, and they became rich again. So becoming rich or being rich, one part of that is also how a person operates, how do they think. Not everybody thinks that way, and so we all are different. So rich will continue to be rich in whatever. I think that this adversity of humans has actually made those who have that being rich uh, leaning, it made them more rich. Zan Solo says, "What's your opinion on Sputnik?" So, Zan, I have actually done a separate discussion about Sputnik. Sputnik, what is interesting about it? Again, all the data that I shared or discussion that I shared is from their site's pages. So, it is really whatever they say. What is interesting is that they have two adenovirus that are involved in this dose 1 and dose 2, and because of that their claim is that if it is the same adenovirus in both doses, then it is possible that our body would not react to it, thinking we have adenoviruses generally as well. So by mixing the two species of adenoviruses, one of them is bound to provoke the immune system. Having said that, my wife had J&J. It is an adenovirus-based vaccine, and I find it to be terribly annoying to the immune system. It still continues to push her immune system. So I don't think that one species of adenovirus is any weaker. Sage Mage 29 says, "Can you tell us the difference between mRNA vaccines and J&J?" One, I have a lots of discussions about these. Second, just very quickly, if I share my screen and draw them out, the adenovirus-based vaccine has, of course, an adenovirus. In the adenovirus, this is what we say replication deficient virus, meaning from the DNA of this virus, the gene that helps this virus replicate and grow is removed. So it is made impotent, if you will. And at the same time, there is a gene added to this that makes spike protein. So this adenovirus, lots of copies of this adenovirus are made and bottled up, and that is a vaccine. Of course, there are some adjuvants as well, but that is a vaccine. When this adenovirus is injected into our system, this adenovirus knows how to enter our cell. So really, so Luffy is going somewhere. So really, the benefit of adenovirus is really to just bring this DNA piece in our cell, and the vehicle to enter the cell is the virus itself. So adenovirus attaches to our cell, gets in, then it is destroyed, but that broken carcass of the adenovirus is brought through our nucleus. Over there, it would inject this DNA in the nucleus, where this spike protein DNA will be there as well. That DNA over there will translate into messenger RNA. That messenger RNA will then go to ribosomes. Ribosomes will use this messenger RNA to make spike proteins, and the rest is history. The spike protein is then shredded and pieces are shown on the surface and so on. The messenger RNA vaccines are vaccines which have this messenger RNA present in the lipid nanoparticles. So these vaccines, messenger RNA vaccine, bypass this whole process. They directly manufacture the mRNA outside and then wrap that in a lipid particle and bank on that lipid particle to bring this mRNA in the cell. Because it brings, so this was nucleus. So because the mRNA is brought in the cell, this mRNA is never going to go into the nucleus. It just stays in the cell, goes to messenger RNA, sorry, ribosome, spike protein is made, and the rest is the same. So mRNA vaccines short circuit this whole part, and they just start from here. That's the basic difference. Liz says, should somebody wait to get pregnant after taking the Moderna vaccine? If yes, how many months and why? So the discussion about the pregnancy that occurred, or the study that was shown, that showed that number one, people after vaccine could become pregnant. No, there was no change. And secondly, pregnant women were not shown to have any extra miscarriages compared to others. So, at least from that study's point of view, and I discussed that study, I first misinterpreted that. I created an alarm. I was wrong. Then I took that video down. I redid that video, corrected my message according to the data that was there. I had misinterpreted it, and from the correct interpretation of the data, it was safe. And U.S. empire. I would like to delay vaccination until Novavax is rolled out. What do you recommend in the interim about beyond FLCCCs? So we have done this discussion many times. There are many vitamins. Vitamin D is important. C, CoQ10, um, Manuka honey with black seed oil, and other such things. So I have those in my discussions. And I would recommend that, considering Delta is uh, causing spreading faster, it may be useful to get the vaccine fast. I I don't have confidence that Novavax will be approved anytime soon. Irene says, how long do the spike proteins stay in the system? Very good question, and I have done multiple discussions about this. Somebody today had asked me on a different thread too. There is a talk I have done about the cytotoxicity of the spike protein. I have done another talk which says, how long will a vaccine continue to make spike proteins? Now, to answer your question shortly over here, briefly, number one, everybody's body is going to respond differently. Some people cannot clear the virus, or I would say vaccine, for months because their immune system is not responding correctly. They're immunosuppressed, or they're taking immunosuppressants and so on. In a normal, healthy immune system's behavior, is usually the study that we saw from Japan. They showed that the spike protein started becoming formed within 8 hours, and by 2 days, it had disappeared 84% of it, and then any remaining possible spike protein would disappear in 9 days. But in my opinion, from that study, I think it is 2 to 3 days that the spike proteins will be there and then cleared out. In some people, we know that some pieces of the spike protein, S1 protein, may stick out in the monocyte for a long time and they become long haulers. But this is the general normal healthy behavior, is that within a couple of days, spike proteins will be cleared out. So overclocked says Dr. Bean medical lecture. So mRNA vaccines are seeing waning protection. What about AstraZeneca? So adenovirus-based vaccines, at least from the news, is that they continue to make antibodies for months. That means their protection will not be waning that fast. Having said that, immune system can actually go down. I know that there is lots of discussion nowadays to say the the waning, the earlier somebody had the vaccine, the waning has occurred and their immune system does not bounce back with as much efficacy as somebody who was recently vaccinated. I have to see that study to see why are they saying it, because that is not the behavior of immune system, at least from the SARS-CoV-1 and MERS-CoV. That is not how it works. So I want to see why are they saying it. Is there a hidden agenda in there where they're trying to say you need to have a booster or some other vaccine? So there was a question by News Sample. Does persistent inflammation in long haul caused by S protein be reduced by reducing the immune system? Immune sister crazy response? I don't understand the question. But of course, if you reduce the immune system's behavior, then the body would feel better. Tommy says, I'm a big fan. Thank you very much. A question: what do you think about the Kentucky study cited by the CDC as a reason for people already infected with COVID to get the vaccine? Tommy, I have to look into that study. Uh, Many doctors, some doctors on internet, like I am, and CDCs are, in my opinion, incorrectly pushing to say you must take a vaccine. There are times when a person's immune system is working fine after the infection and they don't need a vaccine. I have clearly said it many times that people need vaccines. But this is unfair to start to say things that are not justifiable. Still, if there is a study, I'll have to look into that study. So, my homework. Let me just quickly write it down somewhere. This Windows things. Uh, Topics. Kentucky study for infection and so I'll look into that one. So BK says suffering blurry vision in both eyes after second Moderna vaccine, no vision issues up before vaccination. Doctors say they can't find anything wrong. Do you have any tips to help? So BK, number one, I'm really sorry, and this becomes very worrisome. I have a patient who developed who had the infection, asymptomatic, then got the vaccine, both doses, and then developed some of these side effects, including vision effect. And she called it as I cannot focus, my vision looks fast, I cannot look at my screens, and so on. She didn't say blurry, but she said vision effects. The I Recover protocol on FLCCC, she went over through that 2 times. And now she says she is 90% better. So, yes, I have heard of the vision issues. They are related to, if it is a reversible thing, then that could mean mostly inflammation either within the optical nerve or within the lens areas. I don't know exactly where the pathology occurs, but what I know is that I Recover is helping because there are anti-inflammatory there, and that should start helping. If there is an autoimmune immune system's response, then because of steroid there, that would also go down. So I would recommend to look at I Recover and discuss with your doctor. I wish you become better soon. Cheyenne says, hi, Dr. Bean, have you seen the paper regarding Lambda variant showing resistance to vaccine in the lab? Is it concerning? So I talked about Lambda already. There was a video I did called All About Lambda. And in that video, I think I had said, or maybe the chit chat afterwards, that watch out, they're going to say Lambda is going to become the next one. They have to keep going from one to the next to keep earning from us. Um, when I looked at it, Lambda did not have any structural competence to actually cause this kind of an issue, but I'll look into it again. So let me take note for Lambda as well. Culturing Resilience says, Dr. Bean, thank you for being genuinely conserved and open to expand your knowledge and perspective to serve the people better. You are very welcome. I have said it many times, none of these things that I share, even including the mechanisms, they're all other people's mechanisms. Uh, Mechanisms from the books, again, authors are other people. Studies that I share, for example, today as well, these are researchers who are other. My total job that I've been doing is to pick those things up and make cartoons and present them. So very tiny role, but I'm happy that this role is keeping us all together on a journey and we are helping each other stay safe. Vailina Perpuri says, is it better, easier on body to wait longer between doses, 6 weeks instead of 3, for instance? Is longer time period between doses better if concern about exposure is low? If the concern about exposure is low, then UK has proved that a longer period of time allows the first dose to keep increasing in efficacy, or first doses resulting efficacy continues to improve. They have gone up till 84 days, and I think that is their now structure, that 84 days later they give the second dose. I don't know if they changed that because of the Delta variant. I haven't seen it. But yes, if it is administratively okay, for example, if there are going to be vaccine passports and they're going to say, you took the first vaccine here, you were supposed to take the other vaccine in 4 weeks, instead you came back in 3 months, we don't consider that to be 2 doses and you need to have one more dose, then you have that problem to solve. If that is not an issue, and if the exposure is not a problem, then delaying, UK has proved from their work that delaying is okay as well. So MSNBC, how's Dr. Corey doing? Any statement from him regarding getting COVID? So I am so bad that every morning, so after 12 o'clock my time, I become busy preparing for these topics. And in front of you, 7, 8, I stay here. It becomes late on his in his time zone. And every morning I think that I have to call him, and I just till 12 I usually have my business meetings. 12 to 1 is the time where I take some lunch and a break, and that is when I decide to call him, and then I start preparing. So it's my bad that I haven't gotten. It's just so bad because he cares for me a lot, and here I am. I would call him tomorrow. So I'm going to actually leave a note to my secretary to help me remind me for tomorrow. So 1 second, please. Okay, so I'll call him tomorrow. This is a good question. So there was a question about Star Trek. So the question, that question is going to throw me off, because the question you're asking is new generation or old generation. I have no idea. I totally uh, cannot remember. I just know I love Star Treks. I love Stargate. I love Star Wars as well. Um, and of course Expanse. Even last night after this, I used to take dinner and then just after some time go to sleep, but I was watching Expanse yesterday as well. So exactly which one are you talking about? I have no idea. I love it. Carlos, tachycardia, could it be because I place it under tongue? Yes, you should not place it under tongue because it will get absorbed fast and go directly to heart. We need it to be going through the GIT and get through the process. So good that you're feeling better, but yeah, please don't put it sublingually. So Soma and Srijoy Ghosh says, what is your views on plasmid DNA vaccine? Is the safety and efficacy and procedure of working quite the same? I do not know if they have made plasmid. Are you talking about the ones which they make in the bacteria or the moth cells outside, and then they collect them like Novavax? Or there are other such vaccines as well? They're good vaccines, not bad. So Jocelyn says, if I think I had COVID in March 2020 and had an antibody test 4 to 6 months later and was negative, could that be inaccurate because antibodies are low by that point? T cell test 16 months later negative. Yes, so it is possible that antibodies have waned because active immunity has settled down or rested. Now, the T cell test after 16 months, generally memory cells should live around. However, we saw a study where they said memory cells would go and live in the bone marrow. So they may not be still circulating in the blood, but they may be sitting in the bone marrow. What I'm waiting for is the following: someone who had the infection 16 months ago and they expose their, uh, they got accidentally exposed, for example, and they keep doing PCR on them. For example, there are people who work in essential areas, let's say with presidents and others, where they get tested every day. So imagine such a person who got infection a year ago and they are tested every day. And when they get the virus, if they get the virus, how quickly do their body produce antibodies and how much? That would tell the use of the B cells and T cells that may be in the bone marrow, especially the B cells. Rima says Dr. Bean and movies is like Groundhog Day. For me, so that is the funniest thing. Now that you all know this, it is the funniest thing that. So my wife sometimes says, for example, she said, "Hey, we have new Expanse season," and I said to her that I'm doing these talks and I need to prepare, so I won't be able to join her. So she watched those seasons, and then I said, "Okay, now I'm ready." And she said, "Sure." And I said, "Do you remember where had I left?" And she said, "No, I don't." And she said, "Well, you can start from the beginning and I'm sure you will enjoy it." So that's what happened. I started from the beginning. And I was talking with her yesterday and I said, "I have no clue of anything except the woman who is, I don't know, secretary or someone in the bigger Star Wars government, and she wears that sari kind of a thing, Arjun's wife. That is the only woman I remember that I saw her in the movie last time as well. She's still there. She has not left the season. But exactly what was the story, I had no idea. So I'm enjoying it again. William Goff says, "Thank you for all you do for us. Your videos are such a source of hope for so many. You appreciate it so much." Thank you very much, William Goff. And I hope you are doing well. Danilo says, "So can we make a pre-jab which contains all growth factors, ions, vitamins, which enhance immune system and give it before the jab so immune system would work more actively?" Danilo, the problem is we don't want immune system to become overactive. We want it to be balanced. So you are correct that something that gives us all those things, I think multivitamins with vitamin D a little more than normal could help, but you have a good idea. Sola says, "Miss Luffy talking." So he's a mister, and best regards to Mobeen, and thanks for the lessons and discussing. You're very welcome. So Luffy has gotten up, gone, and now he is singing the songs of his people. It's his practice time. Um, Ali G says, "Is Chinese vaccines good enough against Delta variant?" All vaccines have the same problem. Either they are good or they may not be. But if a vaccine is good enough to train the immune system, then it is a person's immune system, how much of the memory cells were produced, and then how fast can they respond. So, if the memory cells were produced and if in good number, then it should be fine. I just do not have that data, Aliji. Cool. So, let's do this. Let's stop for today. We'll continue tomorrow. Uh, Please like, subscribe, and share. And if you would like to support this work, there are 3 links. You can use them. One is to buy me a coffee, or you can use PayPal, or you can be a patron. So thank you very much, and I would see you tomorrow.